Hey everybody, Dr. Young here. With the Major League Baseball draft coming up this weekend, I thought I would take a minute to go over what the MLB Vision Assessment form has and why vision is so important for baseball players. Let's break it down. All right, so the first thing you need to know when getting your eye assessment for the MLB draft is your exam has to be performed by an eye doctor. It can't be done by your primary care provider or any other provider. It has to be done by an optometrist or an ophthalmologist. And the reason why is these are the vision experts that are going to be able to do the specific tests required for Major League Baseball. We know that baseball players have some of the best vision of all athletes all over the world. And so this sort of breaks down some pretty specific tests that can be done to check that. Of course, you're going to have your regular history. They want to know whether you wear glasses or contacts and if you had any injuries or especially eye injuries, concussions, things like that. We've got visual acuity. So that's when we think of the eye chart, or you're reading the eye chart, what's your vision? Well, the best hitters have better than 20/20 vision. Most major league players have 20/15 or better. Some have even gotten down to like 20/10, and that's insane. So, but that we check here in the office as well, so we can see if you can get down to 20/10. There are a couple of things in this visual acuity box that talks about high contrast, low contrast, dynamic visual acuity, and contrast sensitivity. So we assess some of these things on our Synaptech sensory station, but we're thinking about contrast sensitivity. That's the ability to pick up something against a background. And the best athletes in the world have the best contrast. They can pick up a moving target against a background. It's like picking up the ball out of the pitcher's hand with, whatever's in the background. Could be trees, sky, stadium, stands full of people, and the ability to distinguish that object very quickly from the background is important. So contrast sensitivity is something that we check. And dynamic visual acuity is, how well can you see something when it's moving, basically. So those are things we use the Synaptech sensory station to assess for you. Binocular vision, that is how your eyes work together as a team. So your eye doctor will perform a cover test, and that just determines your sort of resting posture of your eyes. Do your eyes want to be straight? Do your eyes want to, point out or in when they're resting? Things like that. And that sort of helps the doctor understand how hard your eyes have to work to point at the target together. Stereopsis is basically your depth perception. So you can check that at distance, you can check that up close. And if you can imagine, your depth perception at distance is a little harder to distinguish, because the further something gets away from you, the harder it is to tell exactly how far it is. But the best baseball players have very good distance stereopsis because they can see the ball coming out of the pitcher's hand and determine how far away it is. Up close is kind of when you see the ball connect with the bat. What is your depth perception there for close work? Moving over to the right side of the form, they have the recommendations from the eye doctor there in the middle. Does the doctor prescribe you glasses or contact lenses? Let's hope that it's contact lenses. And your doctor should be able to give you the absolute latest technology in contact lenses, which is what we do here. If you're going to be hitting a baseball, you absolutely have to have the best contact lenses on your eyes to give you the best possible vision. You don't want your eyes drying out. You don't want the contact lenses sliding around and fluctuating your vision. So a lot of that is determined in your contact lens evaluation by your doctor. There are these additional tests up here, anticipation timing. You can do sort of a reaction time test. Again, we use the sensory station from Synaptech to assess that. It does about 10 different tests, including those. And then let me jump back down here into the treatment recommendations where it says visual skills and neuro training. These are also, the MLB form is asking you, the athlete, these questions. All right, did you have any visual skills training? Did you do any neuro training? That's basically the same thing that we do here in the office with the Synaptech sensory station. We're taking a look at how quick is your reaction time, peripheral awareness, visual acuity. There's multiple object tracking. There's a whole battery of tests that I can explain to you in a second for the synaptic sensory station. But they want to know if you've done some of these, to maybe done some vision enhancement, some training. We do that here in the office. And the last part of the form is the eye health exam, which is, that's an important part of the exam. Your doctor may dilate your eyes and take a look in your eyes. We want to make sure that the front of the eye is healthy, no dryness of your eyes. It says blepharitis specifically. That's just inflammation of the eyelids. If you've got inflamed eyelids, your vision's going to fluctuate quite a bit. So that's got to be treated and under control if you're going to perform your best. The slit lamp is the microscope that's used to look inside the eyes and at the front of the eyes, looking for abnormalities there. And a fundus exam just means they're looking through your pupil into the back of the eye, whether you're dilated or not. They need to look in there and take a picture or some kind of evaluation of your retina, make sure that's healthy, make sure your optic nerve looks good. And so there's different measurements there. And the last thing on this list has intraocular pressure, and that's usually done at your routine eye exam, and just to make sure that you don't have some other problem with your eye, with maybe an ocular hypertension or something like that, or glaucoma. So that's the form. Let's break down some of the stuff that we can do with the synaptic sensory station. Okay, so I've got an analysis pulled up here for a baseball player done on the synaptic sensory station, and you can see here that it does, there's kind of this web result, but once you understand it, it's pretty simple to break down. We've got 10 different tests. Visual clarity, which is basically your visual acuity. This person had 2017 in each eye and both eyes together at 2013. So that's excellent visual acuity, and that's that kind of baseball visual acuity that we see. Contrast sensitivity is measured here. Depth perception, near far quickness, that is how quickly can you respond to something that's in the distance versus up close, and so it ranks you there. Perception and target capture, it does these things to assess how quickly you can respond to things in your peripheral vision. We've got reaction time. We've got multiple object tracking. Can you keep track of multiple things going on? That's that neurological thing that we were talking about on the form. Then we have your hand-eye coordination and go, no-go, which is what I really like. This is decision making, and this is where younger athletes can improve quite a bit with some training, and the more experienced athletes, as they get seasoned and they learn this, they perform better. So this athlete was a younger athlete. He could use some decision-making training, go, no-go. That's basically deciding when to swing. And so this does an initial assessment, and then you can identify the areas of need, and then you can run some training, and then they do the training on this board or maybe some things we have in the office. And then we reassess after a few weeks of doing the training, and we'll see these numbers start to improve quite a bit. And then the athlete, that just translates into them doing better on the field. So that's it in a nutshell. The Major League Baseball Vision Assessment form. Hope you found this useful. You can have any of these evaluations done at OptiCare Vision Centers. Check us out at opticarevision.com.